Today I will be talking to you about a patient who came to me to the OPD. He had developed a rash and the patient told that he had severe electric shock like shooting kind of a pain. The pain was so severe that the patient could not even wear a shirt because if any cloth touches that rash, he had severe amount of pain. Can you understand what this pain exactly is? Let me explain to you. This pain is called as postherpetic neuralgia. Postherpetic neuralgia is actually a complication of an infection called shingles. Now, most of us would have got a chickenpox infection during our younger days. But remember, even though the infection has reduced, the virus never goes away from your body. On the contrary, the virus lives inside few of the nerves inside your body, remaining dormant. Now, whenever there occurs a scenario where your immunity gets decreased, this virus gets reactivated, resulting in a complication called as postherpetic neuralgia. This postherpetic neuralgia results in a certain kind of a rash which is present over your trunk. It usually comes on one particular side of the trunk along a particular nerve. What exactly happens is there is development of rashes first. Then the rashes turn into blisters. Slowly the rashes and blisters will go away, but the pain remains. And this pain is one of the worst possible pains experienced because it is along the nerve. There is an inflammation of the nerve, resulting in this complication called postherpetic neuralgia. One of the most common symptoms is a pain which is shock-like, stabbing, electric shock-like along that particular rash. This pain usually increases in certain conditions. One could be if usually what happens is there is too much of cold, too much of heat temperatures, the pain can increase. Other symptoms include itchiness around that rash, which is very disturbing for the patient. Numbness can also occur, and these symptoms usually either come in attacks or stay for a long period of time. Most of the time, your doctor is going to take a thorough history and do a physical examination. These are the mainstays for diagnosis of postherpetic neuralgia. Few lab investigation and lab tests may also be done, which will confirm your diagnosis of postherpetic neuralgia. Postherpetic neuralgia is one of the most difficult conditions to ever be treated because there is not one particular treatment which is superior above the other. So we follow a certain protocol called multi-disciplinary management. Medications are used. The usual common over-the-counter painkillers are prescribed initially. If it does not reduce from that, we use nerve numbing medications. One important application over here is usage of certain thing called a patch. We have a certain medicated plaster or a patch commonly called as the Lidocaine or the Lidocaine patch, which is applied over the rash area, and it usually provides good benefit for the patients. Now, if patients are not getting relief from all of these things, then we have to add certain things called as interventions. The most common interventions done for postherpetic neuralgia include nerve blocks, epidural injections, etc. But as I said, not one treatment is superior over the other, and a multimodal approach is what is usually followed. Finally, postherpetic neuralgia is a condition which needs to be diagnosed early. And one of the very important treatment part is the usage of a vaccine. A vaccine also helps in prevention of postherpetic neuralgia. If you or your near and dear ones are suffering from this dangerous condition, do contact us at Alleviate.